Hello, my yoga fam. Welcome to my YouTube channel, Flow Theory, where we explore yoga, wellness in a very simple and practical way. So, today's episode is all about understanding the spine, something that we rely on every single day, but we often neglect it until it starts causing discomfort and we start experiencing that pain. So, with modern lifestyles becoming very sedentary, with all of us spending more screen time, it is something that even young people are experiencing now. So, to help us understand this better, our guest today is Victoria Thomas, who will guide us through the basics of spinal health and help us understand the common problems and how we can take better care of our bodies. So, just a little introduction about Victoria. She is an osteopath, a physical therapist, and yoga coach. She coaches and mentors yoga teachers that are just starting out their career or who need an uplift in their career as a yoga teacher. She also runs her own clinic and yoga studio, and she also trains yoga teachers in injury management. Welcome, Victoria.
Thank you. I need to get a copy of that introduction because that was really good. And I'm going to use that in other places.
Great. I will share that with you. So, should we get into our questions for our viewers?
Let's do it.
Okay. So, let's start by understanding in very simple terms how our spine is structured and why it is important for our overall health.
So that I was just teaching this yesterday. The spine, we often think of it as this column, this spinal column that we need to be keeping really stiff or strong or mobile. But it's actually a really creative part of the body that has lots of different movement patterns to it. So with the spine, just like the core, we want to do two things. We want to be able to keep it stiff, keep it steady, and that's going to create stability. Let's say if I'm lifting a very heavy thing, I need to be able to create that stability by using muscles around the spine, but I also need to be able to move it. So the spine is often divided into three different parts. We've got the neck, the cervical spine, we've got the mid back, which is thoracic spine, and we've got the lumbars, and that's the low back. And on the very end of the low back, you've also got your sacrum and coccyx. So that's the flat bone and then the little tailbone at the bottom. And it's actually a good thing that we've divided the spine into three because they all do the different parts of the spine do very different things. So the neck is holding up the head, which is about 5 kilograms. So not much weight if you think about the whole weight of the body. We also have quite a lot of arteries and nerves going through the spine. So in this area, it's quite exposed. And the vertebra, which are the pieces of bone which sit one on top of each other, they are quite small and so if you look at a vertebra from here versus the very bottom of the spine, you'll see that the size difference is like this. So the spine at the
Right.
bottom is big. And
Yeah.
that's because it's only holding the head. So the neck has lots of movement, and the neck moves quite a lot in side bending, flexion,
Side,
and
forward.
and that and that is for survival. So we need to see where the danger is, and that's our bodies are mostly designed to be good at survival as well, of course. Same as the nervous system, always looking for safety and danger. So the neck moves a lot because we need to see if somebody's coming round there. So the neck has a lot of rotation and a lot of movement. Of course, now with the neck, we've got the forward head posture because of the computers and the phones. So you see people are carrying their head forwards. And yes, people get quite a lot of pain in the top of the shoulders and some
Yep.
problems in the neck. But actually, the research going into this has shown that actually we don't have as many problems as we thought from the forward head carriage. There are many people that have forward head carriage and no pain. So we can't really say that forward head carriage alone causes pain. Otherwise, everybody would have it, right? So we need
Right,
to
right.
move a little bit forwards in the research on that, and that it's good to have your head back for other reasons, like pressure reasons in the belly and pressure in the pelvic floor. But
Okay.
really, the idea that it's going to put too much weight on your spine is actually now an old idea because the
Hmm.
spine and the muscles are very, very reflexive. So they adapt to the position that we're in. So if I'm always in this position,
Hmm.
the muscles adapt.
It adapts.
They adapt. We used to
Yeah.
think that it was bad and it would cause problems, but
Right.
actually the muscles, they adapt. So the neck is very, very mobile and movable.
Huh.
And then the next part is the thoracic spine. So I forgot to say there are seven vertebrae here in the neck, seven pieces of bone. And in the thoracic spine, there are 12. So each one has a rib attached. So you have rib 1 down to rib 12. And so
Hmm.
this part of your spine is also going to do some forward bending and some extension. But starting from the top going down, it still has a lot of rotation, and that reduces as we go down. So when we turn the head to look for danger, the thoracic spine turns with and helps as well. So lots of rotation there. And the ribs are amazing. People think the ribs are not moving much, but they move a lot when we breathe and when we move. So they are
Hmm.
attached to the spine.
So how it's all interconnected, huh?
Mm. And then you've got your heart, lungs, and all the organs, the liver and the stomach. You've got your liver on the right hand side, stomach on the left, and the rib cage is just coming across on top of those organs. So every
Hmm.
time we move our thoracic spine, we're moving the ribs and we're moving the organs. And
Right.
actually, it's really important for back care. So low back care and, pelvic floor, pelvic health, it's really good to have a mobile thoracic spine. So the problem at the head was this. The problem in the thoracics is stiffness. We don't move that part of the spine enough because we sit a lot like this
Hmm.
on the
Right.
computer and we sit and we get so doing lots of chest openers and lots of exercise and movement and
Gentle
asana,
back bends.
gentle back bends, but back bends that really focus on the chest lifting, which means the
Right.
thoracic spine will move.
Not the compression of the lower back.
That is a different
Yeah.
story. Yeah,
Hmm.
so when we do back bends, we often find that the bend goes into the back. So the
Yeah.
thoracic spine likes to do extension, it likes to back bend, but it doesn't go as much because it's naturally curved like this. So the spine is naturally in a S-shaped curve to give you suspension. It's designed like that so that we can jump and walk and move around without breaking the bones. And we get lots of movement in all of the spine, but in different areas, different movements. So the neck is very, very movable, very, very movable in rotation for danger. Thoracic spine is protective for the ribs, but it also moves with in rotation and can side bend. The lumbar spine, the big ones, these are the big vertebrae at the bottom that take a lot of our weight. They don't move at all, really, in rotation. And so when we do our twists, we're actually
Hmm.
twisting from the thoracic spine. We only get, I think it's like 1 to 2 degrees of rotation for
In the
every
lower.
in the lower back. So
Hmm.
1 to 2 degrees is like nothing.
Yeah.
The lumbar spine is very mobile in flexion, forward bending, and
Hmm.
extension, back bending. And
Hmm.
this is really important to think about when we think about pain or back health, spine health. So actually the core muscles keep our spine nice and stiff. So you've got your diaphragm at the top, underneath the
Yeah.
ribs. You've got your pelvic floor at the bottom. These are just muscles that are tightening to create a nice, strong spine for when we need it. So if we have sort of a laxity or a stretch in the core muscles and they're not really working very well, then the back will just arch and flex and maybe it will get fatigued and then it might hurt. So we get lots and lots of flexion and extension, mostly flexion in the lumbar spine. And that's created by the core. But we also need to be able to use those muscles to create stiffness to make the spine feel comfortable. All together, the spine works together. The spine
Hmm.
works together. Like we do move kind of separately, so more up here for the neck, more down
Hmm.
there for the rib. But actually, when we do our asana practice, or we walk, or we do a Surya Namaskar, then we're flowing through all of the movements: flexion,
Hmm.
extension,
Extension.
side bending. I call it side bending. I think I learned that at university. Some people
Hmm.
say lateral flexion,
Laterals.
and rotation. So the whole spine is going to be moving, and that's healthy. It's probably a good thing to talk about the joints in the spine as well. So thinking
Hmm.
about vertebra, the vertebrae sit on top of each other like this.
Right.
And actually, how do we create movement then? Where is the movement coming from? It's coming from the joints in between the vertebra. They
Right.
are they are synovial movable joints like the fingers, and
Hmm.
they have cartilage, fluids, ligaments on top, ligament capsules. So they are movable joints. So we have
Hmm.
lots of movable joints in the body, like the fingers, like the knees, like the hips, and the spine also. For every one vertebra, there are two at the top and two at the bottom of these
Hmm.
joints. And they are basically just places where the vertebra sits. And that's where we get the movement. So the spine actually loves movement. And actually the synovial movable joints in our body really like compression as well. Compression is fine, little bit of healthy compression. But often when we arch backwards, back bending, often people have pain. And
Hmm.
that is probably, I don't know why that is for everybody. I would need to look at them. But often it's because they've been standing without the core muscles. They've been arching quite a bit naturally, and that part of the spine is fatigued and doesn't
Hmm.
like being pressed anymore. And maybe it can be the muscles that are a bit sore as well. So the muscles can be quite sore in the area. But generally, for healthy people, back bending is really good. Compression is good. But when we back bend, we
Agree.
want to make sure the whole spine is in the extension, not just the lumbers. It's easy to arch back with the lumbers. We want to
Hmm.
make sure that we also get chest forwards and get the thoracic spine to do it
Hmm.
too.
Right. So I
I
think
completely forgot, I've forgotten the question, but I think I've answered the question.
we were understanding the structure of the spine and how it is important for our overall health.
There's one more thing I haven't mentioned that is very important, and that's the discs at the front. So the joints that we just talked about that
Hmm.
we move. So my thumbs and my little fingers are the joints. They are the synovial joints, the ones that move. So when I
Hmm.
do this, I'm moving the joints that are at the back, one, two at the top, two at the bottom,
Hmm.
all down the back of my spine.
Hmm.
The front of the spine, we have the disc,
The
and then we
disc.
have the big bone, really. It's the big bony part of the spine, right? It's the big body of the vertebra, we call it. It looks a
Hmm.
little bit like a kidney bean, you know? It looks
Hmm.
a
Hmm.
bit like
Hmm.
a kidney shape, the body
Right.
of the vertebra. It's the big, it's the big bony part. If you look at the spine, it's that big chunk of bone. And that is not a synovial joint. That is a fibrous joint. That means it's not so movable. And in between those big bones, we have the discs. And the discs are these they are like suspensory, um, like inserts in between each bone that create or help us to create those forces. So when we jump and walk and move around, if the bone was only on the bone, it would break the bone, it would damage the bone. So we have these lovely, I'm missing the word in my head. But they protect the bone between the two bones. And inside the disc, we
Hmm.
have five very, very strong fibers. So the outside of the disc is very strong and it has fibers. So designed to be strong and not to break. So they're really strong collagen and things like that. And in the
Right.
middle of the disc, there is some fluid in the middle of the disc that creates a pressure. So that
Hmm.
when you stand up, the liquid pushes out in every direction and makes that disc really strong. So this is for protection and support, not for movement. So we don't
Got
move
it.
the but the discs do get into trouble sometimes, and I think we're going to talk about that on some one of the later questions. Yeah.
So the next question is, I would like to I would like you to explain to everybody watching this that in today's times, why do people suffer from back pain? Like even young people. What is it in your opinion? How would you explain that?
I am not going to give my opinion because that would be wrong. It's good to give, I like to give the evidence-based opinion. So what do all of the studies say? Because I trust that when they do studies on these things, I trust that if they get an answer that seems like a good answer, or it seems like a confident answer from the data, from the research, then it's best for me to share that because my own opinion would be, oh, it's similar to the truth, but I look at the research and I think that's what I should probably share. And the research, so they've done lots of tests with people, like what
Hmm.
causes back pain.
Hmm.
Sometimes it's just genetic. So there's genetic factors. You're just born with something that means you're going to have more pain. It could be even something like autism or ADHD having a heightened sensory feeling of pain, right? That's just a small portion of people. But a
Hmm.
large portion of people that have back pain because they don't move enough.
Correct.
So it's the sedentary lifestyle that creates back pain, also problems with heart and many other problems. A few years ago, everybody thought that it was about the posture. Where is the head? Where is the keyboard? Where is the seat? Where is the table? And that can help a little bit, but it's not the main thing. The main thing now that we realize from looking at all the research is it's about people not moving. So if you were to
Hmm.
get up every 20 minutes and do some kind of movement, run up and down the stairs, you would
Hmm.
probably have a lot less pain in your back. So
Yeah.
it's also not to do with having a weak core.
Hmm.
That's quite, that's a
Yeah.
little bit, also, a lot of people still say that, and a lot of people still teach that, but there's not enough evidence that just weak core causes back pain itself. Sure, if
Hmm.
I give you a very heavy suitcase and you don't have any core muscles, maybe you had a surgery in your belly, in your stomach, and maybe you really have no ability to use your core muscles, then
Hmm.
sure, you're going to have back
Yeah.
pain from me giving you a heavy suitcase. But if you are sitting at home and you're working on the
On a daily
desktop
basis. Yeah.
daily basis,
Daily
you're
routine.
not, it's not because of a weak core that your back hurts. It's because you don't move, and so the muscles become a little bit tired and sleepy. They don't really work. And for that reason, when you go and do something like lifting a weight or walking a long way, your
Hmm.
muscles will say, "Hey, you didn't teach me. You didn't teach me to do this. I can't do this." Um, Another interesting thing about pain is often a warning of danger, not always a sign of danger. So pain can come when the brain thinks that the back
Hmm.
is in danger, not because it's actually damaged. So sometimes people have pain with no damage. Many people will have had an MRI or X-ray and they say, "You're perfect. You have nothing wrong with you." And you are in pain. And why is that? If pain is a measure of damage, then everybody with pain would show damage, and they don't. Lots of people with pain show no damage. No
Hmm.
damage to the muscles, no damage to the joints, no damage to the bones, but they
Hmm.
have pain. So we know that pain is complicated, and pain comes from a complex array or selection of processes happening in the brain and spinal cord. So that's
Hmm.
basically saying your head office, the
Hmm.
boss, is saying, I think the cold weather is coming and I think we might fall over with the ice.
Hmm.
So the brain thinks that the future holds damage. So because it thinks the future is holding some damage, there might be a fall or something wrong, it it can actually send you pain signals before the event.
Oh,
Yeah.
interesting.
Which is why how we speak to people about pain is so important.
Hmm.
I have many patients in the clinic where They come to me and they say, I'm in pain. Should I avoid this? Should I stop this? Should I not go here? And I say, no, 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 you're fine. Like, keep moving. Let's breathe. Let's move. And often they feel 50% better just from my words because
Mm.
the pain was actually also the
So
fear.
sad.
I need to stop my games. I need to stop the grandchildren. I need to stop going to the school. I need to stop. I need to lie in bed. And that
Mm.
fear, the fear of the repercussions and the fear of the situation they think they will end up in causes the pain, more pain.
Mm.
So the short answer is move, move your
Mm.
body.
Movement is
Um,
medicine, like they
but
always say.
also I think modern day humans they expect to be pain free all the time. And I think it's important to say that life can have pain in it, and that's okay. So
Mm.
it's not always about making everybody perfectly pain free. Because I've always got something in my body that's, because I live, I do the gym, I do this, I do that. So I have, genetics, hypermobility. I learned for myself that expecting 100% pain free or selling people the idea that they should be always 100% pain free is not right.
True, true. I
And
so agree to that.
that's almost where the yogic philosophy comes back into the picture and says that we're observing ourselves as we are
Yeah,
and
mindful.
not always trying to change everything.
That's right.
So that's my opinion on why we get back pain. Why do so many people get back pain? 100% of adults in the world will
Mm.
experience back pain in their lifetime. That's a real thing.
So you did mention that, weak core is could not be a reason for having back pain, but I wanted to understand that what is the role of our core muscles in protecting the spine? Does the core protect the spine?
Absolutely, yes. So I think we should elaborate on my point about the weak core. I think that the reason why I said that was because a lot of people think that their pain is because of a weak core, but actually their pain is because they didn't stand up for 8 hours, they're sitting for 8 hours. So actually, if we zoom in on the core is definitely protecting your spine. It's holding your spine.
Right.
Um, it's holding the spine up.
Hmm.
Without it, you wouldn't actually be able to stand up. So your core is a group of skeletal muscles. You've got your pelvic floor, you've got your oblique
Hmm.
muscles, you've got that's the on the rib cage
Hmm.
and down on the hip, down on the front of the hip. You've got your abs, your abdominis, rectus abdominis. You've got your transversus abdominis, the deep tummy muscle, the corset muscle. You've
Hmm.
got some deep back muscles called multifidus that are also considered the core. And they work together, contracting to hold the spine up, to hold the spine steady.
Hmm.
The spine is actually quite strong in
Right.
itself, but without the muscles, the you would be on the floor. So yes, actually, if you really have a weak core,
Hmm.
let's suppose you had the abdominal surgery. So somebody has actually cut maybe they've had cesarean for a baby
Hmm.
delivery. They cut through the muscles, and therefore you will have some problems with using those muscles for a while.
Hmm.
That
Hmm. Hmm.
definitely can lead to some back pain. But in
Of
general,
course, yeah.
the core is this amazing group of muscles that holds the spine steady. But the second job of the core, so it's like a king and a queen. The king is it holds the spine steady, and the queen equal is it moves the spine. So we can't keep it steady all the time, or you wouldn't be able to walk anywhere. You wouldn't be able to lean down and pick something up from the floor. You wouldn't be able to give your friend a glass of water. We need to be able to move the move the spine. So your obliques, they turn your body like this. Your rectus abdominis help you sit up and flex your spine. Your back muscles help to extend your spine and lean back. So the core has two roles. Number one, stiffen and protect and stabilize so that you can lift the heavy suitcase or
Hmm.
hold the baby.
Hmm.
Number two, move the spine. You need to be able to move to stay alive, right? Humans need
Right.
to move. Everything does come back to the like kind of like survival because that's what we're designed. A lot of the things in our body are designed for survival and how to survive. So your neck needs to move a lot so you can see, and your core needs to move you so you can run and that kind of thing. So the pelvic floor is really interesting because the pelvic floor is holding the organs up, but it's also and helping us with continence, so bladder and bowel. But every time we contract the core muscles to hold the suitcase or the baby, the pelvic floor is involved. It's one of the core muscles. It also pushes up to
Hmm.
help create intra-abdominal pressure so that we can stiffen up and hold the baby or the suitcase or whatever. So
Hmm.
pelvic floor is important, and the core is like a canister that has lots of liquid in it, and sometimes we squeeze to create like a very like a really stiff vacuum in there. So it's stiff and it sits like that.
So one can also say that, post pregnancy, like during the postpartum, the pelvic floor muscles become very weak. And that is one reason why women have back pain. And plus, there are many other things. That's also one reason, right?
Yeah, yeah, and also the posture from pregnancy is very extended in the lower back, and the pelvis is tilted forwards.
Hmm.
And in that position, the pelvic floor is at a disadvantage, and the core muscles seem to be on stretch. So we like to bring them back into center to bring the pelvic floor and the core muscles back in as well to make them stronger again. But actually, when we're pregnant, when people are pregnant, they don't necessarily, they will weaken the core, yes, but it gets overstretched. And that's the other problem. So
Hmm.
the actual connective tissues and muscles get overstretched
Hmm.
during pregnancy. And that can also damage the ability for you to use those muscles. So that's why you need to practice doing core exercises and special, not special, but some exercises are better for postpartum.
Right. Yeah.
Yeah, like doing the dead bugs when you lie on your
Dead bug,
back.
yeah. Even with a ball or, keeping a
With a
brick in between, that's very helpful.
yeah, I really like that. Yeah, it's really good.
Yeah.
I did that
Proper
with somebody
pelvic floor
the other
muscle
day.
engagement.
Very important when looking at core exercise to think about the bottom of the core, the pelvic floor.
Right.
Yeah, very important. So contract and release, king and queen. Again, the king and the queen analogy. The king and the queen are equals. So
Hmm.
king contract, queen relax. Do it. I've never used this analogy before. It's just coming out today. But yeah, king and queen, equal measures. That's the best way with the pelvic floor when you're doing core exercise. And when you
Got
breathe
it.
in, do you mind if I quickly talk about breathing in and core and spine?
Absolutely, you must, yeah.
So when we breathe in, the lungs are, the volume of the lungs is expanding to
Hmm.
take the air. So the lungs have to say to the rib cage, get out the way, move, move,
Hmm.
move. I need to get bigger. And the same thing happens at the bottom with the diaphragm. So the diaphragm goes down, it actually pulls down to suck the air in. And then we are now going to be increasing the pressure in the abdomen. So when you see your belly go up when you breathe in, we're increasing the pressure in the abdomen.
Hmm.
We're also stretching the core muscles because the core muscles push in when they contract. When you breathe in, they have to stretch. And the pelvic floor does the same thing. So, because the lungs are trying to increase their volume, we must allow all of those things to move out the way. Therefore, we must allow the pressure to increase in our abdomen. So when your belly goes up and the sides of your abdomen move out, that is good. That is good. It is a stretch for the pelvic floor and the core muscles, but it is necessary for the body to take the air in. So usually if we're doing like a supine lying on our back exercise for the core, we'd breathe in and let the belly come up, let the lumbar spine arch. Let it arch. You
Hmm.
can put your hand at the back. This is all good. It's all good
Or a
practice.
blanket, yeah.
On the exhale, this is where we can start doing the core exercise, and we can start looking at Muller bandha and pelvic and core contraction. So
Hmm.
exhale, we don't often, we always bring those muscles back in, and they kind of just come back to center, but we can add a bit of a squeeze if you want to do a core exercise. So exhale to do bridge.
Hmm.
Exhale to lift and squeeze, especially if somebody has back pain or pelvic issues. Doing an exercise like this where we teach them how
So
to do the
did
breath.
you just say like when you're doing a bridge, when you lift in a bridge, you should exhale?
No, not always. You can do
No.
any breath for a
Ha,
bridge, it's
okay.
fine. But if you are looking at doing a core exercise and you really want to improve the core and improve the spine and improve
Hmm.
like maybe they have pain, maybe they feel weakness,
Hmm.
then you can do your bridge on the exhale because it makes sense to use the core muscles when we're
Got
doing
it.
the
Yeah,
exercise.
that
So
totally
doing
makes
it,
sense.
if you're doing an exercise,
That's a very
use
good
the core
insight.
muscles. Yeah.
Hmm.
And then make sure that you tell people to, when they practice like that, sometimes they think that they have to do everything on an exhale forever. But that's not life. Life
Hmm.
can't happen on an exhale. Life has to happen on inhale and exhale. So when you do the exhale exercises, it's just temporarily until they feel like their core, pelvic floor, and their spine feel better.
Got it. So, earlier you mentioned that, when our body knows that it's in danger, it gives like the signal and warning and, to our body. So, is there a way to find out whether a pain is muscular or, is it something more serious?
That's a really good question. That is a really difficult question as well. So
Yeah.
in physiotherapy and osteopathy where I work,
Hmm.
um, we 50 years ago, we would always test, is it muscle, is it joint, is it disc, is it nerve? And we have specific tests. So yes, you can use the tests to find out. And usually muscle is the most painful thing in the back, in our back.
Right.
So when people have 10 out of 10 pain, they often think that it's definitely the bone or it's
Hmm.
definitely the joint. But actually, the most painful thing in our back is the muscle.
Hmm.
However, not we, they did study, like the people who do all the studies, the people working in research, they did a lot of studies on pain in the back. And they realized that where it hurts and how much it hurts doesn't correlate with the tissue.
Hmm.
So it
Okay.
doesn't. It doesn't. So we can't know. We don't know. So then we
Hmm.
have. So now even the X-ray and the MRI, no help. It doesn't
Hmm.
always tell us. Now, if I do an MRI, it will tell me that I have, one little problem at that vertebra. But that's also normal for my age, for example. So it doesn't always tell us why the back is hurting. So the answer is we don't always know why the back's hurt. And that's why we have
Yeah.
a new name. There's a new name in science now for back pain, non-specific low back pain, non-specific low back pain. Every good physiotherapist is putting that on the diagnosis, on the
New
paperwork,
category has
because
come in. Yeah.
it's the new category because actually it's not right to tell people that we know that it's muscle or we know that it's bone. You can't tell.
That's right. Yeah.
Yeah, we can't tell. Sometimes if you have so there's a few things that you can discern. Number one is a nerve impingement. If somebody has
Yeah.
a nerve impingement, I could tell you exactly which level. It's L2, L3, or L4, or L5. It's because each level has different symptoms. So
Hmm.
level 5 in the low back, the bottom, it would give you pain in your little toe all the way down to your little toe, then I
Very true.
know, that's L5, it's this level, and that's where the
Hmm.
nerve is damaged. So
Hmm.
that is true. And also with bone, if people have like an actual bone fracture, then the pain
Hmm.
is so bad all
I
through the
know.
day, through the night, then I would be
Excruciating.
thinking, yeah, then I'd be thinking, okay, that's not non-specific low
No.
back pain. That
Yeah.
needs an X-ray. And on the
Mm.
X-ray, you can see there are things you can definitely see on the X-ray. Bone breakages, cancer. Cancer is one reason why people get back pain is cancer. It's very rare. Of course, most back pain is not cancer,
Right.
but
Okay.
sometimes it is 1% of people
Hmm.
or less than 1%.
So we don't have much time left. Um, if you could give one piece of advice for lifelong back health, what would it be? I think you already mentioned it earlier.
I would say it's a combination of forgive your tribulations, because actually we know that like mental health and how, not mental health is
I don't think
separate to the
anybody
point.
expected that.
Yeah. But we
People
we
will be
know
like,
that
okay, she's gonna say do a cobra. If you
no, I
can't do
think
a cobra, do the Sphinx pose.
one of the yamas and niyamas talks about looking cleansing your own, I can't remember the word now, but cleanse your
Saucha.
own. Saucha, thank you. Saucha. Saucha, cleansing your own mind, it helps your pain. So stress and anxiety and depression obviously cause more pain. So that's number one. Number two is eat well and move a lot. So move well. So don't sit for more than 2, 3 hours, and try to get up every 20 minutes.
Hmm.
I don't always do that, but in a perfect world, that's what I would do. But eat well. So eating, don't smoke. So you got to look after so saucha, 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 saucha all the way, and you'll have no pain in your back. Saucha, then you get an enlightenment at the end as well. Yeah. You didn't expect that from me. But I'm being funny, but I mean like, cleanse your mind. Don't
No,
have
you're
stress.
being
Stress is bad for pain.
no, you're
Honestly.
being yeah, no, you're not being funny. You're being very, very intelligent about it. Very deep.
Yeah, that's true, but that is true. But cobras are good, planks are good, bird dogs are good. Using resistance bands are really good with your yoga, and
Yeah.
um and just yeah, no, yoga in
Even some of
general.
the Iyengar props are very good.
Iyengar props are great. Using balls and blocks are great.
Yeah. All right. I think we've covered most of it, and you have given us a lot of insight today. So thank you so much, Victoria,
Thank
for
you
being a
so
part of
much.
this. And I wish to do more
Yes, we'll do
podcasts
another.
with you, mini podcasts. So Victoria had to leave, but that was a wrap for the episode today. And I hope that the conversation helped you understand your body a little better, and it reminded you of, being a little more mindful about the way you move, you sit, and you take care of yourself. So, a big thank you to Victoria for sharing such valuable and deep insights with us today. And thanks to everybody for listening to this episode. And I hope it resonated with you. So, please comment and let us know how did you find this podcast. We're looking forward to your feedback. Thank you so much. Take care. Bye bye.